All right, so today we are diving headfirst into the world of trauma care.
Yeah, we're going to try to equip you with the must-knows.
Yeah, exactly. Those essential things that medical professionals use when they're facing, those really high-pressure emergency
Like
situations.
that.
And we're taking all those dense medical textbooks and kind of like
Distilling.
distilling it exactly to the good stuff so you can walk away feeling empowered, not overwhelmed, right?
Precisely.
Because nobody wants to be overwhelmed by medical jargon.
Yeah, it's about taking action, not panicking.
Exactly. So picture this. You're in a situation where someone needs immediate medical attention. Our source material today, initial assessment and management, it's like the ultimate playbook for these scenarios.
It is, yeah.
And it kept highlighting this thing called the golden hour.
Right, which is a bit of a misnomer. It's not actually about a full 60 minutes, you know.
Oh, really?
Yeah, it's more about that critical window right after an injury.
So, like, every second counts.
Yeah, when taking swift action has the biggest impact on whether someone pulls through.
Okay, so it's less about the clock and more about that immediate response.
Absolutely.
So what happens during this golden hour? What's the first order of business?
So medical professionals, they rely on a systematic approach. And this is where you'll often hear that acronym ABCDE.
A, B, C, D, E. Okay.
Airway, breathing, circulation, disability, and exposure.
Okay, they tackle them in that order.
Yeah, because it's all about prioritizing. Those are the things that pose the most immediate threat.
Makes sense. I mean, you can't really move on to anything else if someone's not breathing.
Right. Exactly. You've got it.
So let's break down the A, B, C, D, E's a bit. Starting with A, airway. It seems kind of straightforward.
It does. But you'd be surprised how easily an airway can get blocked, especially if someone's unconscious.
Even a minor blockage can become a huge issue, right?
Absolutely critical.
Now, our source material mentioned these things called oropharyngeal airways.
Oh, yeah.
And I've got to ask, what are those? Because the name sounds a little intense.
They are, well, picture like a curved tube that helps keep the airway open.
Oh, okay.
Yeah, and medical professionals, they're trained to use those to make sure oxygen can get in.
That's good to know that they've got those tools ready to go.
Absolutely.
So we've tackled the airway. What about B, breathing?
Right, so with breathing, it's more than just checking for a pulse. It's really about those signs of respiratory distress, things that, even you or I might notice.
Like if someone's chest isn't moving normally.
Exactly, or if
They're
they're
just
struggling for each breath.
gasping for air. Yeah.
Exactly, those are the telltale signs.
So it's like our bodies have these built-in alarms, and knowing what those alarms look like is key.
Yeah, for sure.
Okay, so what about C, circulation? And that's where checking the pulse comes in, right?
It is, but there's another test that anyone can do, really straightforward. You just press on a fingernail and you see how quickly the color returns. And that's called capillary refill time.
Mm.
And if it's sluggish, it could mean there's a circulation problem.
Wow, it's like a little secret medical handshake.
Uh-huh.
But now we're in the know, too.
Exactly.
So we've made it through the ABCs, but this golden hour, it doesn't stop there, right? We've still got D and E to uncover.
You got it. Moving on to D, disability. And now when we talk about disability here, we're really talking about neurological function, how the brain is working after, a potential injury.
Okay, that makes sense. So how do you assess that so quickly in those initial moments?
So they use something called the AVPU scale. It stands for alert, verbal, pain, unresponsive.
Ah.
It's a fast way to figure out someone's level of consciousness.
So if someone responds to a voice, but they're not totally aware of what's going on around them, that tells you something.
Exactly. It gives you a starting point for understanding their neurological state and helps figure out the next steps.
Kind of like a mental checklist for an emergency.
Exactly. And finally, E, exposure. Now, this one might seem a little counterintuitive. Like, why would you take clothes off in an emergency?
Yeah, wouldn't you want to keep someone warm, especially if they're hurt?
You're totally right. And preventing hypothermia, that's a crucial part of E too. But think of it this way. You can't treat what you can't see.
Right.
Exposing the patient, while obviously being really careful about their body temperature, it lets you do a full head-to-toe check. You got to find those hidden injuries.
It's like that saying, but instead of no stone unturned, it's no bandage left unturned, right?
Exactly. You need that full picture to give the best care.
So it's not just about checking boxes, this ABCDE approach. It's like a whole mindset of how to prioritize in those critical moments.
Absolutely. It's about those life-saving actions right after a trauma happens.
And once you've addressed those most urgent threats, then what? Then the focus shifts to stabilizing the patient, right?
Hmm.
That's where we get into those hands-on procedures, those techniques we were talking about. And our source material, initial assessment and management, it really dug into hemorrhage control.
Which is key because uncontrolled bleeding, that's a huge risk in trauma.
Of course.
Direct pressure on the wound,
Yeah.
that's often the fastest and most effective way to get that bleeding under control.
And if that's not enough, what if direct pressure isn't working?
Then you might need a tourniquet.
Ah.
Not always the go-to, but it can be absolutely life-saving when you're dealing with really severe bleeding.
It's amazing how something as, I don't know, seemingly basic as just applying pressure can be so crucial.
It all boils down to controlling those things that are super critical for survival, right?
Totally. Now, our source material also mentions something called a FAST exam. What's that all about?
So FAST stands for Focused Assessment with Sonography for Trauma. Basically, it's a really quick ultrasound.
Okay.
It's used to find internal bleeding really, really fast.
So like a portable X-ray vision for doctors?
You could say that. It's a way to get essential information about what's happening inside, right there at the patient's side, without having to do anything invasive.
That's incredible how technology is playing such a huge role.
Absolutely. And another thing that's super important that our source material highlighted is cervical spine protection.
So protecting the neck and spine.
Exactly. In trauma situations, you always got to think worst case scenario, especially with potential spinal injuries.
Right, so immobilizing the spine is key.
Absolutely. That means using a neck brace, other techniques, just to make sure there's no movement that could cause more damage.
It's all about minimizing risk, minimizing a further injury.
Exactly. And another thing that's super important for stabilization, and our source material dug into this, is shock management.
Okay, now when I think shock, I think, someone's scared or surprised. But it sounds like we're talking about something way more serious here.
You're right. Medically speaking, shock, that's a life-threatening condition.
Yeah.
It's when your body's not getting enough blood flow to those vital organs.
Oh, wow.
And after a traumatic injury, there are a bunch of different reasons why that might happen.
So how do you even begin to manage shock in that kind of situation?
A lot of times it involves something called fluid resuscitation.
Okay.
You're basically making sure the circulatory system has enough fluid volume, enough, liquid in the pipes, so to speak, so that it can work properly.
So giving the patient fluids through an IV.
Yeah, exactly. But it's not just about pumping in as much fluid as possible.
There's a balance.
You've got to find that sweet spot. Too little, and the body can't recover, right?
Yeah.
Too much, and you risk causing more problems, like messing with the blood's ability to clot, which could lead to, more bleeding.
Wow, it's like you're trying to build a house of cards, but on top of a waterbed, it just wouldn't work.
Exactly. It's about being precise and calculated with those interventions.
I'm realizing just how much goes into this, all the factors they're considering, making these decisions on the fly.
It's really, really complex, and that's what makes this field so amazing.
It's not just about knowing what to do, it's knowing the why and the when.
100%. And that becomes even more important when you start talking about specific populations. Different people, different situations. Trauma care, it's not one size fits all.
Because everyone's body's different, they react to trauma in different ways.
Right. And that's actually what we're going to dig into after the break. How age, pre-existing conditions, even just the scale of an incident, it can all change how you approach trauma care. So stick with us, because it's about to get even more interesting as we take this deep dive to the next level.
And we are back, diving right back into this fascinating world of trauma care.
Where things are rarely straightforward.
Right, like we've talked about the golden hour, the ABCDEs, those essential techniques to get someone stable.
Right.
But as our trusty source material, initial assessment and management points out, it's not always clear-cut.
Definitely not. It's about adapting on the fly.
Because people are different.
Exactly. And that's especially true when we're talking about kids or older adults. Trauma care isn't one size fits all.
So even though on a basic level, our bodies react to trauma in somewhat predictable ways,
Right.
when you factor in things like age, pre-existing conditions.
It adds a whole other layer of complexity, absolutely.
Take pediatric trauma. I mean, kids aren't just small adults, are they?
No, not at all. Their bodies, they just respond so differently to injury.
Their physiology is just different.
Completely. And their emotional needs in those situations are completely different, too.
Right. You can't forget about that aspect.
You can't just treat a kid the same way you treat an adult.
You need that specialized knowledge.
Exactly. The way you communicate, the specific things you do medically, it's all different.
Our source material really stressed that, right? Like treating children, it's its own thing.
Absolutely. A whole different ballgame.
And then on the other end of the spectrum, you've got geriatric trauma, treating older patients.
Right, and that comes with its own unique challenges.
Because a lot of times, older adults might have other health issues going on.
Exactly, and medications. Lots of medications to consider.
And those can really impact how you approach treatment for an injury.
Absolutely. You've got to think about potential interactions between those medications.
Right.
How age-related changes in the body might change how you make decisions.
It's like solving a medical puzzle, but with all these extra pieces thrown in.
That's a great way to put it. You've got to connect the dots.
And do it all quickly.
Exactly. And that's what makes it so demanding, but also so rewarding.
Absolutely. And then there are those situations, I mean, we've been talking about individual patients so far.
Right.
But then you have these mass casualty incidents.
Where everything gets amplified.
Exactly. Where it's not just one person, but dozens, maybe even hundreds, all at once.
The whole different ball game.
How do medical teams even start to wrap their heads around that?
Well, our source material talked about something called START.
START. Okay.
It stands for Simple Triage and Rapid Treatment. And it's designed for those overwhelming situations where you have to make quick decisions about who needs immediate care.
So like a rapid-fire assessment.
Exactly. You assess, you prioritize, because resources are often limited.
And time is of the essence.
Exactly. It's all about making those incredibly tough calls quickly and efficiently.
To save as many lives as possible.
Precisely. That's the ultimate goal.
Wow, we've covered so much ground in this deep dive, from those crucial steps for a single patient
Right. Those core principles.
to the immense challenges of these mass casualty situations.
It's a whole spectrum.
It really highlights just how skilled, how much expertise these medical professionals have.
Absolutely. They're the ones running towards the chaos while everyone else is trying to escape it.
So well said. As we wrap up, what are we hoping our listeners take away from all of this?
Yeah. What's the takeaway?
We don't expect anyone to become a trauma surgeon after listening to us.
Right. Of course not. But
But even this basic understanding, this awareness,
it can be incredibly empowering.
it can, because it makes us feel a little less helpless, right?
Absolutely. Knowing those first steps, what to look for, it could make all the difference.
Exactly. And maybe it even inspires someone to take a first aid course or something.
That would be fantastic. Knowledge is power.
Because at its core, this is about people helping people.
Absolutely. That human connection in the most vulnerable moments.
Well, to all our listeners out there, thank you for joining us on this deep dive. Stay curious, stay informed, and until next time, remember, knowledge is power.